Hey, for this module on Jonathan Santos, I went to make this great, amazing summary video for you and realized I already did a 13-minute video that I put on the discussion board before you even processed or analyzed the case. Great job learning on this. I can say at this point in the training after 4 modules, your experience as postgraduates really shows up. I teach, as you can imagine, I teach a lot of graduate students, people in the first, second year of their MSW. But you guys are kind of way beyond that, and it's very cool to be teaching you, given the breadth of knowledge and experience that you've acquired, not just with getting your master's degree, but with practicing afterwards. A couple more things about this case. Uh, the list of things you would not say. I smirk every time I hear them. I'm like, yeah, I thought I should say that. I was going to say that too. What we as social workers don't say are the things that everybody else in the client's life is saying to them. We're not the probation officer. We're not the girlfriend. We're not the spouse. We're not the mom. And we don't come at clients with the idea of, don't you know what you're doing to yourself, or if you realized what this was doing you wouldn't do it, et cetera, et cetera. Mostly what we wouldn't say are the moralistic judgments. Nearly all of you said take an empowerment approach, meet the client where they're at, meet them with motivational interviewing. Some of you are very specific about what MI tactics to use. That's great. You need to go with that. Almost anything else comes across as either judgmental or controlling. Judgmental and controlling does not work for people with addictions. It's a tough lesson for so many to learn, that clients are not going to respond to the idea of, I'll feel guilty if I do it, or bad afterwards. They cannot think it through. They cannot think it through. Your efforts to control them aren't going to work. Which is why I suggested for several of you to defer on the CBT. Cognitive behavioral therapy is going to work once Jonathan's brain is cleared up a little bit, but he is on the borderline between sanity and psychosis with his meth use. So we need him to be a little bit more clear-headed before he's going to respond to, being able to remember certain things, to track things, to try to change that internal dialogue that he has. We can work some positive change talk in there using the MI model, but a formalized kind of course of CBT might want to wait. I think there's some wisdom in our forefathers who used to put people in programs for 30 days. The advantage of a 30-day program is at the end of 30 days, you get a sense of whether there's a co-occurring disorder. You get a sense of whether there's an underlying major depressive disorder. Sometimes, certainly you can rule out psychosis after 30, 45 days. Jonathan, he needed 30 to 45 days to 6 months to get the kind of treatment that he needed. Meeting him with motivational interviewing, establishing a rapport, getting him to come back again and again and again, and 12-step facilitation therapy is good as well. That's an evidence-based program. I think it comes up a little bit later in the curriculum, just how effective facilitating somebody's entry into this pro-social community can be, so that they're surrounded by other people who are facing the same challenges to stopping use that they are. Yet the neurological up and down on him is pretty severe. He's going between methamphetamine up and opioids down, smoking, as one of you pointed out, maybe marijuana or cannabis is his primary drug. Maybe that's the one he always goes back to, and then he launches into these, meth binges and tries to control the side effects with opiates. I think that would be worth a look in the long run if it wasn't maybe cannabis from the start. So good. We got through a couple of really heavy modules on the pharmacodynamics, pharmacokinetics of these different substances. Good job with the reading, absorbing what you needed to, leaving what you should have on the table, and we'll move into the next module. Assessment, screening, assessment, evaluation, and diagnosis is coming, and we'll keep it rocking and rolling from there. Any questions or anything? Monday's the best day to get me. I'm at my desk now, grading all day. I do reach back sometimes on Sunday. I'll check my mail and see if the students are looking for me. That's fine. And then, again, Friday, a little bit later in the day. So at any rate, feel free to reach out anytime.